welcome to On Air with B&B.
I'm Brittany.
And I'm Bethany, and we are two mental health therapists with real talk and mental health tips that matter. So today we're going to be discussing what to do if you ever have had a child who you want to get into therapy but doesn't want to come to therapy.
Refusing going to therapy.
Yes, basically. And this is actually a very common thing. We have a whole video on, what to ask in the phone consultation when you're looking for the right therapist. And in most of my phone consults, when I ask parents if they have questions, 70% of them are like, hey, my kid doesn't know I'm calling, or they don't want to go to therapy. What do you suggest? How do you suggest we approach this with them? Hence, this video.
Yes.
So what do we do when your child doesn't want to come to therapy? So, we're going to kind of break it down into different stages, how to normalize therapy, some strategies on how to get them there without necessarily bribing them. Because I know that seems to be at least as a mom, I'm like, what can I give my kid to get them to go?
Yes.
We don't want to do that because it's not a bad thing anyways.
No.
So, what do you think are some good ways, Britt, to normalize therapy to a kid that knows nothing about therapy, or maybe does know
and has a
misconception, has been before, and didn't like it,
had a negative experience with therapy? So I think just a lot of normalizing, kind of like what you said, having normal conversations around therapy. I'm a big advocate and firm believer in modeling behaviors as an adult or as a parent.
To get your butt in therapy.
Yeah, just get into therapy. It may not have to be on a consistent, weekly basis where your child may have to start off therapy sessions in that capacity. But I think modeling those behaviors by attending therapy and wanting to better yourself as a parent or just as an individual in general. Right?
I think also if you are a parent that goes to therapy or has gone to therapy, just talking about that openly, so that it seems just as normal as going to the dentist or going to the doctor or going to the eye doctor,
because that's what this is. These are just appointments to help you feel better and continue to do better.
If you have any self-help books, leaving them around the house instead of hiding them away, because it's nothing to be ashamed of, trying to better yourself and learn and grow, right?
Absolutely. I think normalizing through actions and through words by stating oh my goodness, I feel overwhelmed. I need help.
Yeah, I need someone to help me through this. Yeah. Maybe having, sorry, I have a little cold going on. Maybe having an open-ended conversation about, why people get therapy, so that they know it's not only people who, I remember when I was little, I was like, oh, I don't need to go to therapy. Only crazy people go to therapy.
Yeah, they have that misconception or misunderstanding.
So now, it's normalizing it. It's okay, I just want somebody to talk to that doesn't know me, that isn't in my inner circle, isn't going to get offended by anything that I say, isn't going to judge me if I have a different opinion than them.
Right.
Also, I think just showing your child that there are a bunch of different ways to go about receiving the therapy. People always ask when they do the consult call, is it in person or do you offer virtual?
Yeah.
I always tell them we don't love to do virtual, especially starting out with kiddos, especially if they're younger, if it's a behavioral issue, even if it's not, just to get that connection. Kids, I feel need that in-person connection. But, there have been certain exceptions. I had one mom call one time and her child had a very severe physical ailment going on that he couldn't get out of bed, and so we actually ended up not taking the client. I forget why. It wasn't us. I think they just decided not to go ahead with it. But we were discussing starting virtually because they couldn't attend in person, because they were constrained to their bed at the time.
Yeah. No, I think that's really great. It's important that you're saying all this, Bethany, and I encourage our viewers to even look at our video that you were referring to earlier regarding like what questions to ask when you are making consultations and looking for a really great provider for yourself, for your family, for your child or your children, right? I think it's really insightful to know that there are different options and not everything has to be so limiting or constraint when it comes to these viable options. Just because us as a practice at Powerful Principles, we prefer in person doesn't mean that exceptions can't be made, right? And so I think advocating and vocalizing your needs and your concerns when you're making these phone calls and consulting with different providers and professionals and seeking therapy and counseling for you or your child or your family, I think it's important to ask those questions and just be also transparent and honest about the situation.
Yeah,
right?
definitely.
I know, to circle back to other things as well, like other suggestions on how to like normalize or encourage therapy just to kind of get them in the door, right? I really like the idea of exposure therapy a little bit, and that's particular technique of the exposure ladder by kind of dropping subtle hints, if you will. I think the big ultimate goal would be, just getting my kiddo to therapy, whether that's just walking through the door, sitting in for a few minutes, just entertaining it with no big behaviors. Even if they're mute in the session, that is considered a win, right?
Yeah.
Just going.
And we have, we have so many kids at our practice, but we have a lot of kiddos who are very familiar now. We implement behavior modification into a lot of our therapy, regardless, again, of what they're there for. Because regardless of what diagnosis or what's going on with them symptomology-wise, there are behaviors that come from all of those symptoms. Yes. And so we pretty much do behavior modification in all aspects, but that could be implemented. Like, we have a bunch of kiddos that were resistant at first. If you just come to the therapy session, just come. You don't have to talk. You don't have to participate. You just have to be present. When you get home, you receive, I think Savannah does a marble for the kid that I'm like thinking of particularly right now. And even if he doesn't earn his reward, she gives him a reward if he participates in session, but he gets a reward. There was one I'm thinking back to where he was not having it that day. And I'm laughing, not because, it is funny, like, because not at him, but like with, it's just, this is what happens in our offices.
Yeah, this is what we do.
And the parents are always mortified, and we're like, please don't be mortified. Like, this is what we do here, and that's why you're here. But she reminded the kiddo, even though he was so mad that he was not getting his little treasure box reward that day because of his behaviors in session, she texted mom and on the way home and was like, don't forget to give him his marble when he gets home for attending. And I think his marbles added up to something
at the end, correct.
Right, they were like used as tokens or whatnot. But still, that was his reward for just coming, even though it didn't even go well that day.
Absolutely. I think, with the going back to the exposure like ladder, if you will, technique or strategies, if you read books, like if books are a part of your routine, I highly encourage reading books regarding therapy in a positive light, normalizing that.
We read books to our kids about everything else. I remember when Pip was, like 2, I read her a book about potty training. We read books about, going to school. We read books about holidays and what that looked like. We read books about, our feelings. Yes. We read books about everything, like about being a good friend, so why not read a book about therapy too?
Right, absolutely.
And just add that into the mix of just normal things that we do in life to become better people and to be happier.
Yeah. I think it's going to be really great too, or really important. Like if you do allow, even with like limitations of screen time, like on YouTube Kids, there are short videos that are very appropriate yet educational that paint therapy in a very positive light, and also in a very appropriate light as well. Even though it is currently 2025, there's still this like stigma, if you will, surrounding our field or surrounding counseling in general, right? So that's probably where a lot of their hesitation comes from as like a child. I also want to just take this moment to acknowledge and reassure that this is relatively common, right?
So common.
That's why we created this video.
I mean, kids aren't calling and like, hey, man, I really need to like get some help with this. I'm going to call around and see if I can get into therapy. That's not happening. So my daughter, I talk about her a lot just because, one, she's like everything to me, but two, because I think it helps, you know, give everybody else like whether it be like a client I'm talking to or you guys, like just some context. I've known she is an anxious kid since she was a toddler. Okay. And I kind of thought to myself, she's probably going to need therapy one day. Now, I am a therapist, so we've been doing behavior modification, you know, breathing techniques, coping skills, all kinds of things, reading the books, all of that kind of stuff since she was a toddler. Yeah. And we got to a point last spring where she was in 4th grade, going into 5th grade, and her anxiety had just gotten so intense, and she's getting closer to that adolescent, pre-adolescent age where I don't know what I'm talking about. So everything that I was implementing before that always kind of helped wasn't working anymore. Right. And that's when, you know, I spoke with my husband and said, we really need to start looking into getting her into therapy. So we had time. It wasn't a crisis. And so we started talking about it with her. And she, of course, I don't want to go to therapy. Like, I don't need to go to therapy. You're a therapist. Why can't you just do the therapy? And so we had a lot of like open-ended like talks about this, you know, at length, you know, well, I'm your mom. It's not working when we talk, you know, maybe having somebody else that, you know, you can confide in and you don't have to worry, like, are they going to be upset with me? Because even though I wasn't upset with her, I think kids sometimes think you're going to be. Maybe they don't want to be they don't want to hurt your feelings. Yeah, and they don't want to disappoint you. You know, when I explained to her, like, you can tell them things, like, and unless it's harmful things that you're going to do to yourself, I don't have to know, you know, that really helped her because she was like, well, that's kind of cool. I also told her that her dad and I were going to be going to get therapy too, which she was like promptly like, yeah, you guys need it. And, you know, whatever. These kids. And we do, but, you know, I just didn't appreciate her tone. Yeah. But yeah, like we talked about it at length for months leading up to actually pulling the trigger and having her go. And she was nervous up until basically, I think 5 seconds into her first appointment.
That's so funny. And yeah, like kids may be nervous and that could be like their reasoning for the hesitation of going
about talking to a stranger, maybe someone they don't know.
Absolutely. And so I think it's debunking a lot of those negative stigmas or negative thoughts surrounding counseling and therapy, normalizing it, positively speaking on it. It seems like, you know, I understand that for some kiddos, right, that might be more anxiety driven. If it's like, okay, I'm telling you now that like in 4 weeks we're going to go to therapy, right? And we're not really talking about it, that could be more harmful than helpful in those moments. I just want to use this opportunity to say that. The reason being is because if a child is struggling with, you know, undiagnosed and unmanaged anxiety in unhealthy ways at that time, kind of letting them know without, you know, helping them and normalizing it could be, again, very detrimental. Wouldn't you agree?
Absolutely.
Yeah, because then they could just be anticipating it the whole time. It can increase the maladaptive behaviors or thoughts surrounding therapy. So I definitely, you know, again, recommend to just be transparent with the therapist. Some therapists would do the virtual that Bethany was talking about earlier. Some therapists would meet out in the community, depending on their agency and their practice policies.
You can even ask too, they do, yes, a lot meet out in the community. They might come to your house, they might go to the child's school. To be honest, a lot of kids don't love that though, from what I've experienced, because one, they don't want their friends to know sometimes. They don't want to be singled out. They don't want to miss like recess or lunch, because typically that's when a therapist would would meet a kid at school because they don't want to interfere with their academics. So just in my past experience, they don't love when you come to the school. They don't mind the house so much. And sometimes the house is good because you can, again, work with the whole family. You can see like the actual dynamics of what's going on, what's taking place, make changes in the home. But it is sometimes tricky to find someone who can go to the house.
Right.
Not everyone does. We don't.
Yeah.
We have. It's just not ideal because it can get expensive because you have to pay for the therapist, travel time basically, and all of that. So I think that's more if it's like a severe case, if it's
just to meet the therapist for a couple sessions.
Yeah, sometimes you could do that.
To get the kiddo in the door at the office. Yeah.
Also, ask again during that consult call, ask a lot of questions like, what do you guys do if you have a resistant child? It's a great question to ask the therapist. Because, for example, we have like a little puppy, and he's not a puppy, he's 4, but he looks like a little puppy. And so sometimes, I think you texted me a couple weeks ago, like, hey, can you bring Parker in? On Tuesday at 5:00, I have a new client who's feeling really nervous about therapy, but I told her dad that we have a puppy and she really likes dogs. So I put a note in my calendar to bring him to the office that day. That really helped.
Yeah, and she's been fine. She came in non-resistant. She came in and everything was fine. And, even a couple weeks before that, I had a client that I never got to like onboard or anything of that nature, but was able to refer for other services just because of the severity, if you will, the severity and the combination of intensity of this particular child's behaviors, these maladaptive behaviors. They were relatively severe, and because he's older and stronger, parents couldn't get him physically into therapy, and he was physically refusing. So we were able to get him other resources where a professional would go to the house, right? And so sometimes not all therapists or agencies, and I know we've mentioned this in the past in other videos, but I just wanted to use this moment to say this, that not all agencies or clinicians or professionals are going to be the best fit in that moment, right? If you find a therapist that really speaks to you and, feels like would be a great fit for your particular child, keep them in your back pocket. Maybe your child just needs to work with someone else in the moment to kind of overcome certain obstacles, if you will, and then you can always transition, right, to another therapist as well. But kind of circling back to like how to get a kiddo into therapy who does not want to go, I think another positive thing is just kind of like what you were saying, like having these conversations, but not on a one-on-one basis only, but having conversations like as a family, right? Or with other family members present, maybe not directly linked to the particular child. We don't want to single the child out, to respect autonomy and to respect like privacy and confidentiality and things of that nature, but just normalizing it to say like, wow, like, I didn't know Susie Q got therapy and Uncle Joe got therapy as well.
Like I remember when I pointed out when Pip was getting ready, like people who she looked up to that she knows in her life, I would say, oh, so and so goes to therapy. Oh, she does. Sometimes I even use celebrities as a way to normalize things, like these people who you think
are great,
are the most amazing people in the world and have 0 problems. Guess what, kiddo? They do, and they see a therapist. They do. Yeah, like I remember when I told her that, because we were supposed to go to a Shawn Mendes concert, and he actually ended up canceling his whole tour, and we didn't get to go for mental health reasons. And that was something to be like, look, he had the courage to say, I know some people were probably angry about it, but I was like, look, he had the courage to say, like, I can't handle this right now. I'll give you all your money back. I'm so sorry to disappoint you, but I have to put my mental health first. They're people too. So I think sometimes using people that they may know and look up to or may not know and look up to as an example is another way to normalize going to therapy, and that it's good for everyone.
Absolutely. And it's just nice too, right? Like therapy isn't always just about working, on to better, in a sense, like goals and decrease behaviors. And sometimes like therapy, like in the capacity of a session, it's just so that the child can be seen and heard, right? By another adult who's relatively unbiased, right?
Yeah,
Have you
definitely.
ever heard Piper say like, "Oh, mom, like stop it," whenever she gives you a compliment, or if her dad gives her a compliment, or if she's ever like, "Oh, you have to say that, you're my mom," or "You have to say that, you're my dad," like if you ever give her a compliment or something of that nature. But if a compliment comes from, you know, one of the other clinicians at like our practice, or one of her teachers or dance instructors, "Oh, thank you."
Yeah.
Like, we believe it a lot more, right? So I'm saying all of this to say that it's important that, normalizing positive thoughts surrounding counseling and things of that nature, modeling it. I think it's really great. I loved your example. I never really thought about that.
Which one?
The one that you were saying just now with Piper, and I think it was with Piper. No, it wasn't. Having a brain fart. It was just now with the. Oh my gosh, I'm having an actual brain fart. This happens very often, y'all. It's a fun time. Oh my gosh, I forgot.
We'll come back to it.
Yeah, we'll circle back to that one.
I would love to pretend I knew what you were talking about, but I don't.
No, it was the one you were just telling all of us about with your daughter, and the celebrities.
Oh yeah,
I thought that was such a good.
No, I do. I use that for different things. Because again, she's not that impressed with me anymore. So, I have to find more impressive people that
she like looks up to.
Correct. Yep, exactly. It's so funny. I'm way more impressive than them. Come on, girl.
Yes.
Anyways.
Right? So I think that's really helpful, like, tools. And I just want to, do you have any other suggestions? I wanted to talk about, when you get to the therapy and having, those realistic expectations.
Yeah, I kind of wanted to talk about that, too, because I think talking about expectations with your kiddos before they attend therapy. So say we get through the whole, or not even get through it, but we get them to accept that they're going and that this could be really helpful for them, okay? They still might be scared, but maybe talking about, what do you think, what do you expect when, what do you think is going to happen when you go to therapy? Because, they might all have different expectations and opinions of what's going to happen. What if they think, okay, I'm going to go and then I'm only going to have to go once or twice and I'm going to be, better. I'm going to feel better. I'm not going to feel anxious anymore. I'm not going to feel angry anymore. I'm going to be able to deal with my emotions appropriately instead of, inappropriately right away. So I think just explaining that we have to have realistic expectations. And that's another thing that parents ask me. I feel like I'm going to sneeze. Is how many sessions do you think they're going to need? And I've probably brought this up in past videos, probably the consult video again. But I always say, I can't honestly answer that for you because you could have 10 kids who have the same symptoms, but come to therapy and have a different longevity of therapy because of their
different personalities, different motivators.
Yeah, I mean, just their uniqueness, right? Of how they interpret the information they're learning, how open they are to learning it, if they're practicing in between sessions. So I think talking about expectations with your kids about what they think they're going to be versus what they may be,
right,
is a really good open-ended conversation to have with them prior to coming to therapy and throughout, as well, so that when they come, they're not discouraged or disappointed and then don't want to go back.
Right. I think while we're on the topic of expectations, I think it's important for the parents to have a realistic expectation as well. If you have a child who really is struggling with just going and attending, especially in person or in any capacity, right? Any platform, if you will, but just attending therapy or attending their first appointment, and they show up, whether if it's virtual and they log in and they're just there, even if they're mute, right? Or if it is in person and they walk through the door and they just sit there and their arms are folded, but they're present, they're physically there. That is a win, right? We cannot anticipate or expect a child who was refusing to go to therapy to then overnight for the first appointment be jolly and happy and excited and not nervous to try something new, right? Or try something different.
It might even take months depending on the child. I remember seeing one of our other clinicians in the office. She had a teenager leave her office one day and she said something. It really made me laugh. Like, I think she said, "See you next week," the clinician did. And then the client said, "Can't wait." And she was a teenager. And it just made me like laugh out loud. And then the clinician said to me, "We actually had a really great session today." And I was like, "Oh, did you?" You know, because you couldn't tell. But, you know, that was growth, I guess. The fact that she was even talking and coming, and she didn't say, "I'm not coming next time." She, you know, may have rolled her eyes and made a sarcastic comment, but she also still alluded to, "I will be there." You know, can't wait. Yay. I was like, that's hilarious.
Yeah, I have some teenage clients that are like that. And we have great sessions and they've made tremendous progress, right? Progress can't happen without the client working.
Right.
We
can't do the work for you guys or for your kids. Right. I always use that analogy or that saying of, you know, I can lead the horse to water, but I can't make them drink. I can teach your kids and I can teach you and encourage, but really that's as far as it goes. I can't do it for you, and I don't want to do it for you because I don't want you to need me throughout life. I want to give you the tools to do this on your own. That's what therapy really is.
Absolutely. And then just even asking if, you know, the first appointment could just be like a parent initial intake.
Yeah, we have a lot of those. I mean, obviously we would love to see the kiddos so we can set eyes on them and see how they respond and react to things. But if we have to do it in slower stages, that can be done too. We don't want to put any pressure on anyone's journey, or, you know, it doesn't always have to look the same as somebody else's journey. So we talk about that a lot on here. So if we need to do it more slowly, then so be it. I mean, you had one kiddo, you were doing several parent sessions before the child was going to attend, and that's okay too. Obviously, I know that's not what this video is about, but like depending on the place that you go to, if you're going through insurance or private pay, that could dictate, you know, how they have to do therapy and how many sessions your child and you get. So again, that might just want to be a question if you have a child that is more resistant to going. Maybe if you have to go the insurance route, you know, maybe that's something to consider. How could I maybe not go the insurance route? Is there a sliding scale? Is there a grant, a scholarship, something along those lines that could help, because I'm going to need more than 12 sessions because it's going to take my child possibly 4 or 5 just to get comfortable before we actually get into like the meat and the potatoes of it all, you know?
No, I'm glad you said that, because that's very true, right? And I think it's important to know if you do have like a resistant child that is going to be attending counseling and you are going through the insurance route, right? To get, whether like just to pay your copays or whatever that looks like, I do think it's an important factor to consider, because historically speaking, resistant clients who are still resistant in the first session or even the second session, historically speaking, again, they do take a while to warm up, which is fine. It's not impossible, and it's nothing that Bethany and I have not seen as professionals. Again, though, to be transparent and to be blunt, those particular clients do take a longer time to seek results. And again, that's just because they need to be motivated, and that's
the relationship, the rapport takes longer to build.
The comfortability, right? To be vulnerable, to see that growth and to see that progress. So again, these are all really important things that Bethany and I think are helpful for you guys, because we've heard this so frequently. I think especially recently I've heard it a lot, like, oh, in lead calls and things of that nature with new clients, like, my kid doesn't want to come, what do you think I should do?
I think going back to the expectations too, maybe setting your child up for success rather than failure when it comes to this. I have a client yesterday who did not come to therapy. His mom showed up. She walked in the door. I was like, where is your child? And I thought something like had happened, like an argument or something, and nothing crazy happened. They had the day off of school. It was a Jewish holiday, and they had the day off of school, and mom thought it would be fun to take him and his friends to Defy, which it was probably really fun. But what happened was then they went to the trampoline park. They did all these activities out and about in the community all day, and then they went home. And this particular child, once he goes home after a long day of doing things, he kind of, it's not that he shuts down, but he's kind of like just mentally done. Like, he doesn't want to re-enter. Like, he doesn't want to go anywhere the rest of the day, even if it's fun, even if it's enjoyable. Like, he wants to come to therapy actually, but yesterday, because they went home, he was just like not having it, and he really dug in his heels, and mom was like, well, I'm not going to argue with him, and she came instead. And we actually talked about this. I said, maybe next time just being more like cognizant if we have therapy on a day that there is no school, because normally he has school and he comes right from school. And so there is not that whole like, I'm home and now I'm in like rest mode and I don't want to go back out. So just maybe being like more cognizant if we do have like a holiday or a day off or something, of like not going home if we are out, or not going out, and having such a big day before. So just like setting your kid up for success rather than failure, because kids are very different than adults, where even though we're like, oh, I don't really want to, like, we have to, like, we're more, oh, okay, I already paid for this, or I already made a commitment. Like, you have to remember, these are, smaller, less developed brains, they're not thinking like that. They're just thinking, I'm tired, I'm home, I don't want to go out. It's nothing personal, so again, if you have a kid who's resistant or not resistant, just kind of thinking about that. What kind of a kiddo do I have? Because some kids are not like that. Some kids can come home, leave, come home, leave.
But you know your kid best.
They go. But some kids, once they're home, they are done. Like, they do not want to go out. I'm actually like that.
I could be like that too.
With working out, I have an exercise bike at home, because if I get home from work, I am not going to change and then go out to the gym.
Yeah.
You know what I mean? So I have it at home so that when I come home, I just change and get right on the bike before doing anything else, or it's not happening.
Yeah.
But I know that about myself, but I'm also, a lot older. So kids aren't going to really know and recognize that about themselves. So we kind of have to do that for them.
No, absolutely. And I think too, last point, I think it's important to remember as parents, like, most of the times, a lot of the resistance and hesitation comes from like the child just being nervous, anxious, or scared, right? Or worried or concerned of things that they're thinking in their mind, of how they're perceiving this is going to go, right? And so I want to leave this like thought-provoking question for like all of our viewers, mostly parents, right? Or even clinicians who may have even resistant clients. Ask yourself, like, how can I create an inviting and encouraging, environment to promote therapy? Because that's the only thing that's going to effectively counteract the anxiousness, by being safe, by being inviting, and also being supportive. Forcing does not really help. It increases and exacerbates the anxiety and could be detrimental to the whole entire clinical like counseling experience. How or why is that? You're kind of setting this narrative as this is what you need to do. This is the expectation, which it is, right? But we're kind of doing it in a negative way when we're forcing the kid. think about it in like this light, right? Whenever you have like a child and you're forcing them to do that, does that make them want to do that thing more or less? Less.
Totally
right?
less. Yeah.
Absolutely. But if the child feels like they have a choice or that they can gain benefit from this, which aka most of us as adults view most things like that, right? If the child can view it like that, you have more of a successful opportunity with a smoother, maybe not easy, but a smoother transition or opportunity to trying out therapy, right?
Yeah, definitely.
Yeah. Well, thank you guys so much for tuning in with us on Air with B&B. I'm looking for